at Smile Care here in San Antonio, Texas. Today, as part of our ongoing series of educational videos, we're going to talk about bad breath, or commonly known also as halitosis. You know, bad breath gets a lot of fun made of it. People talk about it and kid about it, but it actually can be a very serious subject, especially for those afflicted with it and affected by it. So what I want to do in this video today is examine what are some of the causes of bad breath, and more importantly, what are some of the things that we can do about solving those problems. It's estimated as many as 60 million people in the U.S. have some form of chronic halitosis, and we'd like to help those people and also the people that are around them. So here we go. So some of the external causes, you know, this is not rocket science for all of us. It's a lot of the foods we eat. It's the things we put in our mouth that are supposed to be there and some things that shouldn't be there. So the foods, you know, garlics, pepperoni pizza, onions, those are commonly known to cause bad breath, and they're short term. There's things that we can do about those. Also, other things we put in our mouth, such as tobacco products, cigarettes, cigars, and smokeless tobacco, in addition to causing bad breath for you and everyone else around you, the oral cancer risk is just not worth it. So just as an aside from bad breath, please quit using tobacco products. It's not good for you and it's not good for your family. On to bad breath. So with external factors, there's usually under our control. I'm not telling you don't go out and eat that pepperoni pizza, but if you're concerned about it afterwards, you can rinse with mouth rinse, you can brush your teeth, you can rinse with water, take some breath mints. Those are things that are going to be short-lived and easy to fix. And there's actually mouth rinses and products that will eliminate the sulfur compounds that are in these foods that we eat. Now let's look at some of the internal factors that can affect our breath. There's some things that are less common, such as people with some illnesses, people that are on especially very low carb diets can get a ketosis breath. In fact, when you're on something like the Atkins diet, one thing you're doing is testing your urine actually for ketosis, but that ketosis also comes out in our breath. It's kind of a more of a sweet smelling breath, but so some people that can be very offensive. But the primary cause for what most of us consider as true halitosis and really bad breath comes from bacteria. And bacteria, it's not the live ones. We have live bacteria in our mouth all the time, and that's why we brush and floss, try to get those out. But if they stay in there very long, they die. Their life cycle is not very long. So when they die, they rot, and it's just like roadkill, and it makes sulfur gases called volatile sulfur compounds. One of the most common ones is hydrogen sulfide, and that's what we know as rotten egg smell. That's hydrogen sulfide. So it's just things that are decaying. So if you don't want rotten egg smell coming from your mouth, then we've got some ways to help you with that. But one of the most common places that people get this collection of bacteria is around the teeth and in the pockets around the gums around the teeth, and then on the top of the tongue, especially toward the back of the tongue. That's one of the most overlooked areas where a collection of bacteria occur, and these bacteria die, and if they're not cleaned off every 24 hours, they're going to start causing bad breath. So we can either use a toothbrush to clean the back of our tongue, and that does a better job than nothing by far. But if we were going to clean this mirror back here, if we used a paintbrush, that would leave streaks. So what would we use when we clean our windshield of a car? We use a squeegee. And squeegees can get a much more smooth surface and get a lot more and not leave any streaks. Now, we're not going to ask you to use that in your mouth. We've got a human-sized version of the squeegee. It's called a tongue scraper. This one's one we have in the office called the Ulet, and it's very effective to clean the back of the tongue. If you want to see how much more effective the brushing, you can brush first and then use a tongue scraper to squeegee off that bacteria, and that gets it out of the deep in between the taste buds and gets it on out of there. So brush, teeth, floss, and don't forget your tongue. The other things you want to do, of course, is go to the dentist, because we even as great as dental people generally are taking care of their teeth, if we had, which we do regularly, check each other's teeth and have our own cleanings, there's still spots that we're missing where bacteria can build up. So you got to come get your teeth cleaned regularly. If you have any dental disease, broken fillings, especially gum disease, that can be a big factor in bad breath, because all this bacteria are hiding out around the gums, around the teeth, and if that's not ever cleaned out, then there's just dead bacteria that are continuing to accumulate, getting off these hydrogen and sulfur smells. So there's things you can do now. The external factors such as foods and things, you know what to do with that. Those are just the classic things you hear about. So it gets advertised, you rinse with this, rinse with that. But there are products that actually do work for treating bad breath. And there was a time where we used to measure bad breath, and still can be done, and you can measure the amount of volatile sulfur compounds, and we treat it with OxyFresh. And a lot of our patients are on OxyFresh mouth rinse and toothpaste, because in addition to eliminating bad breath on our patients, because it acts directly on the volatile sulfur compounds, these dead bacteria also affect the health of our gums. So we're treating the gums, we're treating the bad breath at the same time with some of these OxyFresh products. A lot of dental practices have those in their practice for that very reason. And the other thing you can do is hydrate. Bad breath is commonly influenced by dry mouth, so you want to keep hydrated, and that'll keep your saliva flow up, and it'll help keep the content of the bacteria to a minimum. So there was a time where a dentist found out that we knew something about bad breath, and he called me one day and wanted to come see if I could help him. He was from Shreveport, come flying into San Antonio, and we measured his situation, and sure enough he had a chronic problem. And here was a dentist in people's faces all day and hadn't been able to solve his own problem. The good news was, like for most people with chronic halitosis, the biggest issue was bacteria on his tongue that he had just never been properly cleaning. And we got him using OxyFresh products, got him squeegeeing his tongue, and it changed his life, and he became quite the zealot for helping his own patients handle their bad breath issues. So you don't have to suffer with bad breath. Your friends don't have to suffer with your bad breath, and your friends and family and you will be better for it, and the world will smell better for all of us. So take care of it. If you have questions about it, you can always call our office. You can go to our website, advancedsmilecare.com, and be looking for more of these educational videos on various topics. They'll be coming to you shortly through your email. Y'all have a great day.